It's now time for Sports Medicine with Malempati.
Sports Medicine with Malempati. That's Dr. Chaitu Malempati right there on the screen with me. I'm William Warfield, the King of Stream. And Dr. Malempati, we're going to be talking about ACLs today.
Yeah, William, thanks for having me. Always great to talk with you and see you. So ACL injuries are common sports injury. They get a lot of very high profile. They get a lot of exposure. You see on the ticker on ESPN. Certainly significant injuries because there's a long recovery time, but occurs mainly in cutting and pivoting sports such as soccer, such as football, basketball. Usually is a non-contact injury with a change of direction with a planted leg, and the athlete will typically feel a pop and go straight to the ground and know that something's wrong. But sometimes it can happen with contact as well. Typically, females have a much higher incidence of ACL injuries. There's various theories as to why that is, but we know females have generally about a 8 to 9 times. Sometimes some research studies show 11 times higher ACL injury rates than males. But it's the main ligament in the inside of the knee that prevents anterior translation of the tibia on the femur, and it's really important for cutting sports, and it's the most commonly injured ligament requiring surgery in knee sports injuries.
I've seen quite a few of those actually happen during our broadcasts on PrepSpin. Unfortunately, it's always tough to see an athlete go down like that. What are the surgical options if that happens to someone?
Sometimes, if the ligament is mainly intact and it's a low grade, less than 50% tear, maybe off where it attaches to the femur, you can repair it, and there's more and more people advocating for that nowadays. However, the results of reconstructing the ACL have widely been shown to be better than repairing. And what that means is taking a graft from somewhere else, and that is basically your new ACL, and putting that inside the knee arthroscopically and attaching that on both sides. As far as graft options for reconstruction, typically in contact sports, about 80 to 90%, if you look at Division I and pro sports, it's the patellar tendon graft, especially in high-level athletes, because there's a piece of bone that can heal in the bone tunnel as opposed to some soft tissue healing in a bone. Some people feel that patellar tendon grafts actually can heal quicker as well because that bone heals within the bone. Some other options are the quadricep tendon graft, and that is becoming more and more common, especially in high-level athletes nowadays, especially over the past, I'd say, 5 to 7 years. Another option is grafts, and the hamstrings can be taken. 2 of the 3 main hamstring tendons can be taken, and that can be used as a new ACL as well. You need to avoid those in track athletes and runners, typically ones that really need to activate those hamstrings. And then the last option is using a cadaver graft. Generally, in the research literature nowadays, cadaver grafts have about a 7 times higher failure rate than your own tissue. So, especially in young, high-level athletes, we always try to take your own tissue using one of those 3 grafts. And usually, in contact sports or cutting sports, it's patellar tendon graft that we take.
Yeah, I know. When we hear about people tearing their ACL or needing to have surgery for it. Dr. Malempati, your name keeps coming up all the time. That's the guy you want to go see. We know you're an expert with ACL. Let me ask you this. What's the timeline for recovery and even more so now that technology has advanced?
Yeah, so that's a good question, William. Timelines have changed over the past 20 years ago to 10 years ago to 5 years ago. I'd say, about 15, 20 years ago, we're probably more conservative. Because it takes time for that knee to recover. And then we had a phase maybe 5 to 10 years ago where people were trying to go back maybe at 6 months after surgery. And what we've found now with the research that's been done is the knee generally isn't ready at 6 months. The quadricep isn't ready, the hamstring isn't ready, which are 2 of the dynamic stabilizers of the knee joint. And really, the knee has not healed to the point where it's safe to return to sports, or certainly not cutting sports. So now I'd say we're back to being a little bit more conservative, typically 8 to 9 months. As you know, when you see a pro athlete or a D1 athlete going down with this type of injury requiring surgery, they miss that entire season, right? They're not back for about a year, sometimes longer than a year. The last thing you want to do is have somebody go back before they're ready, because you're really at risk of re-injuring that graft, another ligament or meniscus in the knee, and then you're starting back at ground zero. So what we recommend is doing some functional testing, and there's a various battery of tests that we can do to make sure that the athlete is ready before they go back to sports, and safely.
Dr. Chaitu Malempati, this has been another great conversation with you. The ACL, it's become a common thing, as you mentioned, and we're glad that we have experts in the field of sports medicine and orthopedics like you. And thank you for all you do for us here on the network.
I appreciate it, William. Yeah, anytime, we have a good team approach, and we're always well versed, and we deal with these ACL injuries daily. So we're always happy to help any athletes and we can get them back out there to reach their goals and back out on the playing field.
That's Dr. Chaitu Malempati, and this has been Sports with Malempati, Sports Medicine with Malempati, right here on PrepSpin.